his experience. So Ampelio Mesa, he's a brother from a Bolingbrook Hispanic church. And when he was 66 years old, he was walking outside with his wife when he suddenly had a pain in his chest. And he said maybe it was something else, and he didn't pay so much attention. So he continued doing other activities, and the next day, he felt the same thing. When he said, this is not right, it's something else is going on, and he said he has other symptoms. So he went to see the doctor, and sure enough, they hospitalized him, and he was about to have a heart attack. And the doctor said, I cannot even do angioplasty, or I don't know how you call it, because your arteries are so clogged that we can't do that. We need to do an urgent surgery. But there is no much hope for you to say that this is gonna be okay because of your age, because of the whole other situations that he had. But he decided to go ahead. He said, let's do the surgery. And he prayed, he called his kids, and all the family in church. We started praying for him, and they did the surgery. After the surgery, he was in recovery, and he was well, and he decided to make changes in his diet and make changes in his lifestyle. Again, resting and, do exercises and stuff. So he started at the age of 66, start running marathons or mini marathons. Like marathons is 26 miles, but he started with 13 miles, like half marathons, and he started going to different states, and he has, look at all his medals, and look at him. This is his daughter, who also motivated him, but it was another person. Ampelio Mesa was somebody else's that I never met before. He was energetic, and now he likes to preach, with his own testimony, how important is to start making changes in his diet, in our diet, and also in everything else. All the components are important. So why I'm bringing this to you is that sometimes we think, we are already old to start doing exercise. Who is gonna do marathons when you never did in your life? And if he did at 66 years old, and he's proving us, that means that we have the capacity. We are not different. We are similar to him, right? We may have other health conditions, but we're similar. So that gives me a motivation myself, that it's important to start not only focus on one thing, it's also resting, exercise, and going to take some sunlight, and so many other things that we know already, but we need to start practicing. So now we're gonna I'm just gonna give you 5 tips, and you guys gonna take home this page. I'm gonna give you at the end of this program 5 tips to help in your diet. And I'm not gonna take too much of the time of Dr. Tessalee. So the first one is, can you move to the next one, is choose healthier types of fat and cooking methods, okay? There's always grilling, there's always steaming, saute, or put it in the on the oven, and there's always benefits to change our recipes instead of frying, right? Now I hear that a lot of the women in the Filipino churches now, they have the air fryer, so that's a good idea, right? So instead of doing that, it's better because we're reducing the fat intake, especially saturated fat. Another component that is so important is to start including more omega-3s. So we hear a lot of omega-3, omega-6, omega-9. We can talk about it in another time, but when I focus on omega-3, it has many benefits to help on our heart health, and has polyunsaturated fats that help us to reduce triglycerides and other saturated fats from our arteries. So what is saturated fat? We always talk about saturated fat. Very, very basic, very simple. It's a solid fat. If you make a chicken soup, and when it gets cold, you know, that layer that you see on top, the thick one, that's a saturated fat, something that is solid, versus oils, you know, oils is something liquid. So when we incorporate more, for example, olive oil or something to our cooks or to other type of oils, that's better than saturated fat. And I don't like to use some substitutes like trans fats or other things. Those can be worse. If you're gonna use saturated fats, also small amount. Or if you're gonna use oils, we can talk about something else because they're all different different oils that have different smoke point, right? Some they can burn faster than others. But the key here, the message is less fry, and if you use low oils and very low heat, right? So that's best. And if you want to choose something better for your heart, well, so far, there's so many controversies, but so far we know olive oil can be our best, one of our best choices, or canola oil when it comes to cooking. Can we change to another? So the next tip, quick, we already talked about omega-3s, especially from fish, but if you're a vegetarian, there is also another sources of omega-3, which is the from alga, ¿cómo se dice? Algae, So there's some pills that you can take if you don't want to take from fish. And if you do fish or select fish, at least 2 portions per week. The third one is fiber. Adding fiber to our diet is so important, you know, but important. If you add fiber to your diet, it's so important to include water. So there are a lot of people who suffer from constipation and decided to take more fiber, and it gets worse. And why? Because we don't include water. Those two go together. And walking. If we don't do that, if you increase your fiber, if you don't combine with water and walks, then you're gonna continue with worse problems, okay? And that helps a lot in with our heart health. The next one is saturated fat. I already mentioned saturated fat. Saturated fat not only comes from animal products, but also from plants. But the thing is that when it comes from plants, well, for example, coconut oil or peanut butter, that's a saturated fat also. But so not because it's plant, we can eat whatever we want, the amount. We're still going to work with portion, right? If I'm gonna take, when I eat peanut butter, for example, if you look at your finger here, like 2 of those, that's your portion, okay? And if it's same thing with coconut oil, it's good, it's healthy. There are other controversies about coconut oil, but you still, moderation. Moderation is important. There's other nutrients, other things that we can get from coconut oil. You can still use that, but in a small amount. But when it comes from animal products, because they come other things together, like cholesterol and other things, that's what we're saying. Go with less portion or go more plant-based. Plant-based means more fruits, vegetables or so, and less amount of meat throughout the week. That's plant-based. Or if you want to practice vegetarianism or veganism, that's even a good choice. Sometimes you can choose once a week to say, I want to practice today once a week or twice a week to be vegan. So that's also a good choice, right? And the last one is reduce salt. When you see the little grain of salt, 40% of that grain is sodium, okay? So not all salt is sodium, but salt, 40% of that is sodium. We want to control that. Whenever the doctors say, eat 2,300 milligrams of sodium, I don't know what is that. I don't measure, I don't know, I just eat, right? And I imagine you don't know how much milligrams or grams of sodium you ate today. We don't know. The key here is, let's start practicing. For example, don't bring in the salt on the table. Or maybe putting less salt when I'm cooking. Or put some more lime or herbs and other things that can help me to start to put more sodium into or more salt into your diet. So some people say, well, I choose now sea salt or I choose Himalayan salt. Well, the news is all of them have the similar amount of sodium. Some of them a little less, but not so much. They're similar. But what is good about that is the way they get or they grab the sodium, they have other minerals or other nutrients. It's less processed. So that's the good thing about choosing Himalayan salt or sea salt. But when it comes to sodium, it's pretty much similar. So the key again is limit and reduce or no adding sodium. So all those practices that we have, I can talk in depth about each of this, but it's not my time, it's not my topic right now. But if we practice, and I know all of us, we know this, but sometimes we don't practice, and that's the thing. So small goals. Think about out of these 5, which one you want to work this week. And maybe next week we can start with something else. So today when you leave here, think about, do I want to work on my fats, a little bit less sodium, or maybe I'm going to start thinking about introducing more omega-3 to my diet. I don't know. But whatever you do, it will be a good help to have a better heart, right? Heart health. And remember, not only diet, it's also exercise, it's also rest, it's also trusting God, and so many other points that we already know. Okay, thank you so much. At the end, don't leave with your page, with a copy that I have for you. And now it's time for Dr. Tessalee. Oh, Andrew. Thank you.
Good afternoon, everyone. Happy Sabbath. It's a pleasure for me to minister with you guys, It's just a really interesting time to be alive, huh? So many things going on. The more that you look at the news and you talk to people on the street, it can be pretty disheartening. But I just want to give everyone hope here that Jesus, He's coming again. Not only is He coming again, He's coming soon. And I want to ask this question to everyone here is, whose kingdom are we living for? Are we living for this earthly kingdom, this physical kingdom? Or are we living for the heavenly kingdom? So with this song, this old song, it's just my prayer that you'll be encouraged by these words. A mighty fortress is our God, a bulwark never failing. Our helper, He amid the flood of mortal ills prevailing. For still our ancient foe doth seek to work us woe. His craft and power are great, and armed with cruel hate. On earth is not his equal. Did we in our own strength confide, our striving would be losing. Were not the right man on our side, the man of God's own choosing? Dost ask who that may be? Christ Jesus, it is He. Lord Sabaoth His name, from age to age the same. And He must win the battle. And though this world with devils filled should threaten to undo us, we will not fear, for God hath willed His truth to triumph through us. The prince of darkness grim, we tremble not for him. His rage we can endure, for lo, his doom is sure. One little word shall fell him, that word above all earthly powers, no thanks to them abideth. The Spirit and the gifts are ours through him who with us sideth. Let goods and kindred go, this mortal life also, the body they may kill. God's truth abideth still. His kingdom is forever. His kingdom is forever and ever.
Andrew, thank you so much for that song. That's awesome with a cappella. So beautiful. I'm going to see if we can show this. Hopefully it will come up. You know, I would recommend that those of you who are in the back there, just kind of come in and fill in over here, because you're really going to want to see this, you know, with some of the video stuff that I have to show, because back there you're not going to be able to see anything. See if I can turn this back on. What's up? So I just wanted to mention a couple of things here with the what Anna was talking about with these healthy eating tips. That talk was probably more important than what you're going to hear here about COVID in terms of heart health, because really those are the lifestyle changes that we need to make. And I can tell you that these lifestyle changes are very, very difficult to implement, you know, in terms of what you're supposed to eat, what you're not supposed to eat. You know, one of the questions, and a lot of times we don't know exactly what it is. You know, people say 2 to 3 grams of sodium. We don't know what that is. And unless you actually do it, you'll never understand what 2 to 3 grams of sodium is. But I've actually tried to do 2 to 3 grams sodium. So the way that I would summarize how to share with you how much 2 grams of sodium is, if you had lunch today and you ate and you said that tasted pretty good, you ate more than 2 grams of sodium today. If you tasted it and you said, "Ooh, this doesn't taste too good, it's kind of bland," you probably ate less than 2 grams of sodium. If you have more, I've had a 2 grams of sodium, it doesn't have any taste whatsoever. So it's very, very difficult to do those kinds of things, but step by step. And the other thing that I can share with you as well too is, this is just one of those things that when you have life difficult decisions, you turn to God. You know, you recognize that you have absolutely no control over what you are doing and give it all to God. Discussion with him and prayer also. So that's just to start out. But I'm going to focus today on COVID and the heart. And I feel like I'm speaking during prime time when people are sleepy. Because I am the most sleepy right now, about 2 to 3 o'clock in the afternoon. Even at work, I'm the most sleepy. So I'm going to try my best to keep you guys awake. And hopefully, at the end of this talk, you will have learned something about COVID. You can imagine our grandkids that were not part of this, our future grandkids who will be part of it, they're not going to know exactly what it is that we went through. But you have all gone through this. You're going to hear a lot of the things that you've heard on the news, a lot of things that you live even now in your daily lives. And hopefully I can share with you a little bit of medical information. I tried to make it so that it's not too complicated and not putting everybody asleep. So I have lots of nice pictures in here that I'll share with you. This first picture here, as you can see, you classically see this coronavirus, this virus on a lot of media publications. And this is actually a picture of what the coronavirus actually looks like. And it is sort of a round membrane type structure, and then on the surface of it are these things that come out, and they call those the spike proteins. And those spike proteins are what make this thing here unique in the way that it looks. So, coronaviruses have been around for a long time. Let's see if I can get this thing to go. Coronaviruses have been around for a long time. So when I initially heard about coronavirus, I said, what are they talking about? This has been in kids, cold viruses all the time. Why is this such a big deal? Well, it's a big deal because back in February of 2020, the World Health Organization discovered that this COVID-19, and by the way, this COVID comes from coronavirus disease, right? COVID, coronavirus disease 19. 2019, right? So COVID-19, and the virus that causes COVID-19 is designated. You guys have heard of SARS in the past. So SARS here is SARS, Severe Acute Respiratory Syndrome, COVID-2. So that's what SARS-CoV-2. You'll hear this a lot too. That's kind of like the technical name of what the COVID is all about. And some history behind it. Well, first of all, this is why do they call it the coronavirus? This was just a graphic of a crown, right? Corona, the crown, and that's what this structure kind of looks like. Is that there are a bunch of crowns on it? That's how it got its name, is coronavirus. So it originated. They discovered this in Wuhan, China. It was in a market in China by this Hubei province, and I just put a map here for those of you who are not as familiar, but China down here, I think Philippines, is Philippines down there? Or over here? Down, right? Down and over here. This one. There you go. Well, anyway, it's Wuhan. This is the province where they found this thing. And the way that they first discovered it in 2019 was that there were these cluster of pneumonias that came about. It caused pneumonia. And it spread rapidly, as you know, and it caused a global pandemic. Now, this is actually a picture of the city of Wuhan. So most of you are familiar with these already, but I'll mention them to you because this is official. Symptoms that you have had if you've had COVID. I'll walk back and forth here. 50% of people have a cough. 43% have a fever. Fever is greater than 100.4. Myalgias, so muscle aches or headaches. Dyspnea, so you sort of have this sensation that you can't get a full breath. You can't take a full breath. You have a sore throat in 20% of the cases, and diarrhea. One of the very first cases that I saw in the hospital was a gentleman that came in with diarrhea, and we were focused on his stomach. And I saw him in the morning thinking, this guy's got some kind of a GI thing. He probably ate some bad food. But by that afternoon, he was intubated, and then he was dead the next day. Turned out to be COVID. But diarrhea, so I'm like, oh my goodness. Nausea and vomiting, 12%. And a loss of smell, taste. You guys have heard this, right? Loss of smell, taste, abdominal pain. That actually accounts for less than 10%. But if you have it, and you have all of these other symptoms, that kind of points it in the direction of possible COVID. This is just a chart. A lot of this information that I'm using here is from, doctors use a guide called Up to Date. So I want to really give credit to Up to Date. It's a medical kind of a, I don't know what you would call it, like a menu or some kind of a medical cookbook that we go to that has the most up-to-date research on all topics. So I always go to I always go to up-to-date to get the most up-to-date information. So everything that I'm presenting here today is from that source. This is what it looks like. Coronavirus, it's got a couple of features here. You see in the middle of this thing is the RNA protein. And the RNA protein basically is designed to create those things that are on the surface, those spike proteins that are right on the surface. And then I'll show you why these why these are so important and why this is so unique to this virus. And then the lipid membrane is what surrounds the structure. That's what it looks like. This is just a technical picture of the actual sequence of DNA. that they isolated to find out how this spike protein is characterized. And this is important because, amazing, they were able to get this sequence into the vaccine so that the vaccine can program your body to produce this protein, this spike protein. So it's not the spike protein that causes the issues, and I'll show you that later. But it's very complicated, just very amazing how they actually did it. So my talk basically today is to focus in on some of the heart manifestations of COVID, and so I wanted to mention some of these to you here. This by far is nowhere near complete in terms of our knowledge of knowing what happens. Every day I'm learning about what happens with patients who have COVID and what happens to their hearts. This is all new. I mean, you see stuff that happens, and then people will come to the office and say, hey, doc, do you think this could have been caused by COVID? And you kind of scratch your head like, well, I don't know. I never heard of that before, but it could be. But then when you start to see trends, and then doctors report these symptoms to a database, and then you start to see groupings of these things, then that's how these chapters are written. You know what? There's like a bunch of people that are complaining of palpitations, like their hearts beating extra heartbeats. I've seen that very, very commonly. I've seen patients who have had weakened heart muscles. So myocarditis, where the heart function actually diminishes. There's a recent study in one of the echo journals that showed that there is indeed a dilation of the heart and also a decrease in function. So hypoxic injury, that means that there's not enough oxygen getting to the heart muscle, so that's how it gets injured. There's an entity called stress cardiomyopathy. This is a reversible weakness of the heart. So you get COVID, it's very stressful on the body, the heart muscle gets weak, doesn't squeeze very well, but then is able to turn around on its own. So that's one entity also. The other thing that we see is ischemia, ischemic injury caused by microvascular damage. So what does that mean? The heart is supplied by blood through the arteries. And these arteries are lined by cells. And when you get this COVID thing, it goes and it messes up your cells that line the arteries. It's the epithelial cells specifically. So think about those of you who are in science, now it's a little bit more technical, but where are epithelial cells? The skin, it's everywhere. You have epithelial cells in every single organ. So if it affects the blood vessels, if it affects the lung epithelial cells, this is why you have all these patchy looking pneumonias. These epithelial cells are supposed to keep fluids in their respective chambers. If you disrupt those cells, stuff leaks out, and then all of a sudden you can't oxygenate because the cells in the lungs are all messed up because of this toxic effect of the coronavirus. Right heart strain, which is what we found is that this coronavirus not only affects the epithelial cells, but it also affects the blood flow within the body. So the blood tends to be thicker. They somehow form blood clots. You remember that Johnson & Johnson vaccine, they had a higher number of blood clots from this thing. So blood clots can cause pressures to increase on the right side of the heart, and then you can't breathe, and that's what this thing is called here, this cor pulmonale. Very, very difficult to treat. And then this last thing here, which is probably the scariest thing, is this thing called systemic inflammatory response syndrome. And what happens is that when this coronavirus goes into the bloodstream, your body sees this as a foreign body, and then it just secretes all of these inflammatory products in order to fight this thing, in order to fight off the virus, but instead it causes damage to the whole body. I mean, literally the whole body can shut down from this thing here. Systemic inflammatory response syndrome. There's also a version of this in children, and I've actually seen young patients come in and have that full-blown, systemic response, this systemic inflammatory response syndrome. I'd never heard of it before in kids until I spoke with my infectious disease colleagues, and they said that's what this is, where every single organ just shuts down after you get coronavirus. So those are kind of the manifestations of heart. This is probably an electron microscope picture of the coronavirus. So remember those renditions that you're seeing? That's what it looks like. Circular, and it's got those spikes on the surface, and sort of kind of like it surrounds the whole thing, looks like a crown, but that's what that looks like. Other cardiac manifestations. So there are patients who have coronavirus that don't have to have symptoms. They come in the hospital and they have these abnormal findings, like the ultrasound of the heart shows a weakened heart muscle, but they feel fine. Or they get blood tests done, such as a troponin level. For those of you who are in medicine, this troponin level is a marker in the bloodstream for heart attack, but it's not a heart attack. It's just elevated because this thing is like irritating the heart muscle and causing it to secrete it. So, but no symptoms, but you have these abnormal tests. Some have symptomatic heart disease, and I mentioned that earlier. If you have a failing heart to the point where it's not able to pump blood through, if you have heart shock, cardiogenic shock, or if you have a heart attack where the blood clot actually fills up those arteries, then you have a heart attack, and then that's it, and then you die. So, I deal with the patients who come in with those clots, and actually during the COVID pandemic, when it was going through the first phase there, doing an angiogram on those patients was very, very scary because everybody had to gown up and put on masks, and you couldn't see anything because everything was all foggy. And you're trying to do sort of intricate work and trying to save these patients. And there was a patient that we actually took to the angiogram lab, and we were able to fix his artery. We deterred the heart attack. The problem is, what about the rest? So now the heart's functioning, but then the guy died of a pneumonia. So you do all of these things, but you can't fix the whole system, like the whole body. So these are just some of the things that we found. Patients also come in with cardiac arrest, and that's like the scariest thing to have to code somebody who has coronavirus. This is a very busy slide, but I'm going to go through it slowly here, step by step, to see how is it that this coronavirus does its damage? How does a virus get into your body and mess you up? How does it do it? It does it by a couple of mechanisms. The first thing is direct viral toxicity. I told you earlier about the epithelial cells. On the surface of the epithelial cells, they got these ACE receptors. They're just called ACE receptors. This stuff goes and binds onto those receptors, and it makes these cells dysfunctional. So now you have a nice barrier, right, in the lungs that separates, your air pockets from your blood and from your lymphs, everything. And now all of a sudden there's a disruption in that barrier. Imagine if you had a disruption in the barrier of your skin. Same thing, right? You'll ooze out fluid. If you have a disruption in any of the, barriers within the eye, you secrete all this fluid. This is what happens in the lungs when you get COVID pneumonia, is that it messes up these endothelial cells, and they're everywhere. The other thing the way this virus messes you up is inflammation. All these things here are inflammatory markers that they've isolated from the bloodstream. Those inflammatory markers, these inflammatory things are supposed to get rid of bad things in your body. And they do. If you have a bacterial infection and you secrete this stuff here, it kills the bacteria. It kills good stuff too while it does it. And the problem is that when this thing gets to this thing called a cytokine storm, which means all of these things come out overwhelmingly, then your body gets hurt by it as well. And then that's how people get overwhelmingly sick. And that's how the virus affects the body. Here's the other thing that we just mentioned, right? Thrombosis and vasculitis. So it causes the blood to be thicker. It causes the blood to form clots. And if you get clots your body needs blood. If you have a clot going to the heart, you have a heart attack. You have clots going to the lungs, you have a pulmonary embolism. You have a clot going up to the brain, you have a stroke. You don't want clots anywhere in your body. And the virus causes clot formation. So that's another way that it hurts you. This last thing here, very, very complicated, but they're learning what's happening with this is somehow it triggers an autoimmune response. Autoimmune response, what does that mean? It means that your body produces antibodies to try to go after this thing. And these antibodies are being formed, instead of going after these things, it's going also after your native tissue as well. No good. It's just chaos, right? It's just chaos whenever you have this infection go on. So that's what causes these things. Now you can understand how it can cause a heart attack, Now you can understand why it causes the heart muscle not to squeeze so well, because you're disrupting all of the blood supply and the membranes. You can also see why there is an inflammation around the heart. Viral myocarditis is an inflammation. Now you know why there's inflammation around there. It's because it's causing it. And autoimmune myocarditis. Whenever you have your heart arteries and the heart muscle affected by anything, you can start to have irregular heartbeats. And so you see things such as atrial fibrillation or ventricular tachycardia. Probably the most common thing that I've heard people say, I don't know if any of you have, I don't know if it's soon enough to ask people here if you've had COVID. But those of you who have had COVID or have experienced, did you ever have feelings like skipped heartbeats? Like your heart, yeah, he felt that. That's common, actually. I've even had people have the vaccine, and after the vaccine, they have palpitations. Like they've never had palpitations before. And then all of a sudden, after the vaccine, they feel palpitations. So it does have an effect on the heart. So that's why these things happen. The heart gets kind of irritated, and then you have these extra beats. The good thing about it is that, for example, the lady that came to my office who had these palpitations, they usually go away with the vaccine. If you've actually had the COVID itself, we're not sure yet how long the effects are. And that kind of leads down to these, which I'll talk to you a little bit later, but the time course of what happens after you get COVID. There's this thing that they're discovering very, very recently that they call long COVID syndrome. So after you get it, after a period of time, you know, remember this 1 to 2 weeks? You guys are familiar with this because that's your quarantine period. This is the most active time period. But then after week 2, 3, you start to feel better. And then there's this time frame, 2 to 4 weeks, where some people still have symptoms. They just feel tired. They still can't get a full breath. I mean, it's more exaggerated in some people than others. But, you know, they just can't get back to feeling normal, and they still feel out of breath. And this kind of goes all the way up. By definition, if you still have this by week number 12, you have this long COVID or post-COVID syndrome. And this is another graph here that shows kind of the oscillating time frame of what happens when you get this thing. In the beginning, when you get this, you know, you kind of recover, right? You get all your symptoms and you recover. And then it's like you still don't feel very well, and then you kind of come back up. Some people get up here and they get up to baseline. They go back to the way they normally felt. Some people come up and they not quite the same as what they used to be. You know, they have this incomplete recovery. And then as they're puttering along here, it relapses again, and you start having these symptoms again. We are just learning about this part. All we know is that it does affect us and the way we function. I mean, mental health impairment, inability to return to work, reduced exercise tolerance, risk of obesity. So that's kind of a busy slide, I know, but I hope I kind of touched on all of these important parts here. So how do we prevent COVID from happening? How do we prevent COVID from happening? A lot of you already know these things, right? But I'll officially talk about it and kind of tell you the science behind why we do this. It's kind of weird that we have to actually explain this part, washing hands and things like that. But anyway, diligent hand washing. These are official recommendations from education sources, okay? Diligent washing hands, particularly after touching a surface in public. The use of hand sanitizer of at least 60% alcohol is reasonable to use. And how did they figure that one out? So what they did was they took mucus specimens that had virus, the COVID virus on it. And then they put it on the skin of, like, from autopsy patients. They put it on the skin, and they measured that these things, this COVID thing, was still active and viable up to 9 hours after it was on human skin. 9 hours, okay? And then what they did was they used 80% alcohol, and within 15 minutes, no activity. So when you use the hand sanitizer stuff, you get rid of it. I mean, it's gone. So that's how we got that information. Another picture of how it looks. So by the time you're done here, you can see the membrane. And then on the surface, the crown, kind of all these kind of spikes on here. And inside is all of the RNA virus. That's what's programming these spike things to come out and make it characteristic. Another thing, again, kind of common sense, but in the media every single day and also argued in the media and amongst us in church and in groups and in schools regarding face masks and regarding all this stuff. I'm not here to tell anybody here today that you should wear a mask. I'm not here to tell anybody here today that you should get vaccinated. I'm going to share medical information with you, and you guys decide. Respiratory hygiene. If you sneeze, you cover your mouth. Some people would agree with that. Funny to say that some people may not agree with that. Sneezing, by the way, when you cover, I still see people covering with their hands, so you kind of don't want to cover with your hands, right? You want to kind of cover with your elbow so that it's out of the way so you're not transmitting it with your hands later. Avoid touching the face, particularly the eyes, nose, and mouth. While I was doing this review, the one thing that I found very interesting is that the American Society of Ophthalmology recommended that you don't wear contacts. And I wear contacts. But I just read this, and I'm like, they actually recommended during the time of COVID not to wear contacts because you're touching your eyes. And people that have contact, you do tend to rub and touch your eyes more. And that's a direct route where this virus can get transmitted. Ensure adequate ventilation in indoor spaces. That makes sense too. Make sure there's circulation so that those particles aren't getting inhaled. Opening the windows and doors, placing fans, windows to exhaust air to the outside, running the air conditioning continuously, using portable high-efficiency HEPA filters. You ever wonder how small this thing is? I found this figure very interesting. This is a hair, like a hair, somebody's hair. This is like, you chop off a piece of hair. This is a piece of hair. And this is about 50 to 180 micrometers. This is a fine beach sand, a grain of sand, okay? It's about 60 micrometers. White blood cells are 25 micrometers. This grain of pollen is 15. And this dust particles, right? Got dust particles everywhere. You can't really see them. You got a whole bunch of them. But they are about the size of 10 micrometers. And then red blood cells that are going through your body, these little red blood cells are about 7 to 8 micrometers. Respiratory droplets, like if you like spit, they can be as small as 5 to 10. There's another smaller dust particle, 2.5 micrometers. You know those filters, how they have those grades of how much it filters? That's how fine those filters are, that it blocks a 2.5 micrometer dust particle. Bacteria in the blood is 1.3 micrometers. 1.3 micrometers. Smoke, wildfire smoke is 0.4 to 0.7. And finally, the coronavirus, 0.1 to 0.5 micrometers. That's small. That's really small. Let's take a look at what exactly that looks like, actually. These things here, they're small. I mean, as I'm talking here, stuff's coming out. You can't see them because they're so small. You saw how big the respiratory particles were. But this shows a line of if somebody sneezes, and when I sneeze pretty strong. It shoots really far. This distance here is 26 feet. 26 feet, it's crazy. Hold on a second here. Remember we were talking about like 2 to 3 grams of sodium? We don't know what that is. 26 feet, I don't know how much 26 feet is, actually. Here, Peter, can you grab this? This is a 25-foot measuring tape. I've never pulled this all the way out. So 25 feet is pretty, go back over there. Hold on, what's this up to? Just don't let it go. 21, 22, 23, 24. That's it. It says attention, stop. So 25. So if I sneeze, stuff can get all the way to Peter there. It's crazy. Thank you. Here, just slowly. I mean, it's crazy how far these things go. Now, obviously, whenever you're talking or you're spitting, I mean, it comes pretty close here. And usually it drops within 6 feet. Most of the stuff drops 6 feet in front. That's where we get this 6 feet distancing from. right? We say stay 6 feet at least away. That's why, because this stuff goes out 6 feet. Let's put this in my pocket. So I wanted to show you this. This is a really cool video. That's why I wanted you guys to see come up front. Oh, that wasn't it. There we go. Can you see that? So these are spit particles. This is about 20 inches away from somebody's mouth. Here, Auntie, I'll kind of hold that. 20 inches. 20 inches right there. Okay, so if I'm here, you're going to get stuff. 20 inches. So then they kind of show it, you know, a little bit further out. This is 43 inches. That's 43 inches. Still kind of close to you there. So you can still touch, obviously it's most right here. If I were to sneeze, it still would be right in front of you. But it still can get out there to 43 inches. And I think the last one here shows that super sneeze. Do you guys sneeze where you kind of hold it in, or do you sneeze and just let it all out? At least in church, you try not to do that, right? There's that full sneeze. It can get out that far, and I believe it if you really push that hard. This is also a very cool video, too. This actually shows the different types of face masks. The first series of what you're going to see here is, it took me, I watched this like 10 times. It's so cool. This here is like with nothing on your face, no mask. This here is with one layer of cloth mask. This is with 2 layers of a cloth mask. And this is with a surgical mask. Okay? Let's just take a look. So in this first video, the guy counts 1, 2, 3. When do you think you spit the most? 2, 3, 4. Let's watch. So this is counting. Just keep an eye on that first one. And they're counting 1. And watch when he says 2. 1, 2, 3. 3 is pretty bad too, actually. 4. You know, I can actually see my own spit. Now that I'm paying attention, even me saying it, I can see it. Here's 6. Oh, 6 is pretty bad too. 7. But you see, I mean, this thing is blocking it. This is blocking it too. This is not blocking it at all. 9, and then I thought 10 would be more, but I guess he was saying 10 without emphasizing the T, because it's not really, nothing's coming out there. This is when somebody's coughing. You're going to think differently about somebody who's coughing next to you. Look at that. We kind of know this, though. Have you ever seen those videos online where somebody comes up to the, and they start playing this trick where they go behind somebody's back and they go, and they spray them in the back? It's actually very irritating. But imagine you being in the store and somebody came up to you and went, and then sprayed. You'd be pretty upset that they were doing that. But that's how it is there. Here's a sneeze. So this is still, it's still coming out. There's still something here with the surgical mask, but it certainly is definitely mitigated with, you know, with a mask. I mean, something's, again, it's very funny that I would have to tell everybody here that wearing a mask actually helps with not spraying your spit. I don't know why that's an argument, but it is an argument because people are saying yes or no to mask wearing. So, well, it's your, like I said, I'm not here to tell anybody that, you know, whether or not you should wear a mask. I'm not making any political statement, but I'm here to share this medical information with you, and it's your choice. This is what this coronavirus looks like. Another picture of it. This long COVID, post-COVID syndrome, they've kind of tabulated some of the results of what some of the symptoms are, and that is fatigue. But it's weird because I always feel fatigued. Dyspnea, up to 71%, so not being able to catch a full breath, still being short of breath. Chest pain or tightness, I've had that in some of my patients, and then cough that persists. And then less common persistent physical symptoms are where you can't smell. I've had patients who still can't smell. For those of you who've had COVID, have you lost your sense of smell at all? I don't know, did you lose your sense of smell? You did? About 2 weeks. Okay, so sometimes this persists. Dizziness, insomnia, diarrhea. This is what I was talking to you about in terms of that post-COVID thing or whatever. First week, second week time frame, third, fourth, and this is where we all are at right now, a lot of us. And then this is kind of the recovery and relapse phase here. So I wanted to do something here, and I need a volunteer. I want to see if, let's see, who can I ask to be a volunteer? I need somebody to, yeah, maybe, how about Jason? I'm not going to do anything. No, so, all right, here, you know, I want to try something here. This is, so just, if you can just stand right there. Remember we were talking about like 6 feet. So what I'm going to try to test here is, if I spray this is COVID vaccine, this is like COVID-laced stuff. So I want to see if you can feel this at all on your face, but you have a choice. You want me to wear a mat? You want me to cover this when I do this or not? Which would you rather? I'll do it either one. You really would want me to, huh? Okay, so it's not 100%, is it? It's not 100%. It's going to come out the side. But why would he want me to do this? Why would he want me to wear a mask? Seriously. I mean, I'm protecting you. I'm protecting. He's wearing a mask. Even if I would ask, would you want to take off your mask or keep it on while I do this? If you would choose to maybe keep it on, which is nice that people would do that. But anyway, this is actually. Windex, I sterilized this. And this is like purified water. So, the most effective means to prevent post-COVID conditions, what do you think the most effective means to prevent post-COVID syndrome is? Not get COVID. How do you not get COVID? What we just talked about, yes. Oh, sorry. I said, how do you not get COVID? You try all the things that we talked about here. You can do vitamin D3 too. There's a lot of things we can talk about. There's like a whole list of things you can do that can help with this. I'm a big vitamin C person and also a zinc person as well. But there's like no randomized study that actually proves this. You talk to any doctor and they'll look at you weird. I use the zinc and I swear by it. Some people say, there are no studies that help. All I can say is if you do the zinc, if you do your vitamin D, you do your vitamin C, it doesn't hurt. However, if you don't wear a mask, it might hurt. The second one, it is likely that any measure that decreases the incidence of severity of the acute infection will in turn decrease the incidence and severity of post-COVID. That makes sense. I'll say that again. If you do anything that decreases your chances of getting COVID or decrease the symptoms of COVID, then the chances of you having the post-COVID is going to be less. So how do you decrease that? Well, vaccination. Vaccination actually decreases the symptoms. And I'm going to show you a slide here as to why the vaccination works. Why is it that it decreases the symptoms? It's very amazing when you look at the science behind this. This last thing here, a case control study found that both symptom intensity in the first week of illness and persistent symptoms as defined by symptoms at 28 weeks were significantly less common among those who developed post-vaccination SARS infection compared to unvaccinated cases. So it's just less. It's not none, it's less symptoms. So you want less of all of that. This is a statement from all of the medical guidelines and journals. Vaccines to prevent SARS-CoV-2 infection are considered the most promising approach for curbing the COVID-19 pandemic. I'm not telling you to get a vaccine. I'm just showing you the medical information, and then you decide on what you should do. But this is how it works, by the way. It's very ingenious. The vaccine is an mRNA vaccine. So what it does is that when you get injected with this stuff, it gets incorporated into the muscles. Most of us had it in our deltoid, in our shoulder muscle here. That muscle cell takes up this messenger RNA, and your muscle produces a spike protein. So that's how it works. The cell sees this and says, it's programmed to create a spike protein. Why do we want to create a spike protein? Isn't that going to kill us? The spike protein is seen by your body and taken up by these B cells. It's just how your body fights foreign bodies. It takes it up because it's like, whoa, this shouldn't be here. But when it takes it up, it doesn't cause all that stuff that you saw earlier where it actually is toxic to the cells. It doesn't stimulate a flood of inflammatory markers. What it does is these B cells produce these guys, these neutralizing antibodies. Neutralizing antibodies. So check this out. If you have neutralizing antibodies and you get infected with COVID, this is a COVID, these neutralizing antibodies attach onto the COVID. Right? That's what this thing was programmed it to do. It latches onto here, and that thing, that virus, cannot attach onto you. It's blocked because of these neutralizing antibodies. It won't attach to the ACE receptor, so it doesn't go into the cell. Obviously, it's not 100% because people still have symptoms if you get COVID, but it sure makes a difference. Look at on this other side here. If COVID gets into your body and you don't have that neutralizing antibody, it attaches onto this ACE2 receptor, and now your body is going to start to create all this havoc because of the COVID virus. Isn't that cool? I thought that was pretty cool. I never knew that. that's how this worked on a cellular level, is that they produce these neutralizing antibodies. I always thought, man, why would I want to get injected with the virus? You're not getting injected with the virus. It's not a live attenuated virus. It is a messenger RNA. And once this thing happens, once it goes into here and your cells are programmed to produce this spike thing, this stuff just dissolves. It just goes away in the body. It just gets eaten up and it just goes away. So that's how that vaccine thing works. So I hope that you guys learned a little bit of something with the COVID. You learned some of the acronyms here of how we got the COVID name and why it's COVID-19 from 2019. You guys will remember that. And also the SARS, which is acute respiratory viral syndrome. And so that is a summary of COVID and the heart. So I hope you guys enjoyed that. Any questions at all? We have questions. Yeah. They only recommend what? 1 meter? Okay, so I don't know how much a meter is compared to 6 feet. So half. So in the schools, by the way, they have actually decreased that number to 3 feet. Okay, so let's set aside how we're trying to live from the science, okay? If you had COVID, I'd want to be in another room. I don't want to be 6 feet or even 3 feet near you. But we have to live. So the school system, in order to make that possible, they're saying, well, maybe we can just be 3 feet away from each other. It's a compromise. So that's the reason. There's no science behind 3 feet is, you saw the spit thing. I mean, if you're 3 feet, you're gonna be closer, you have more of a chance. But we're trying to just accommodate, we're trying to live also instead of being in a bubble. I think that's the answer. Any other questions? Yes? So that's a medical question. He asked, is it okay to take ACE inhibitors? So for those of you who don't know, ACE inhibitors are blood pressure medications, and they work by attaching onto the ACE receptor in your body and vasodilates. So there was initial concern about that. They were like, well, you know what? Maybe we should stop using the ACE inhibitor because it's attaching onto these receptors. It might make you worse. And then they said, well, wait a second. If it's attaching onto a receptor, maybe it'll help block the virus from attaching. Maybe it's better. Maybe everybody should be on an ACE inhibitor. There are no studies that support either way. Either way. If you're on an ACE inhibitor, don't be afraid. Keep taking your ACE inhibitor. It's not going to hurt or harm you. It'll continue to treat your blood pressure. So, another question.
Yeah.
Oh. Say again?
Fermented. Is it okay to take natto, N-A-T-T-O, to prevent clot formation?
I don't even know what natto is.
Fermented soybeans.
Fermented soybeans.
Yes.
If somehow that thins out your blood, if somehow it is an anticoagulant, it thins out your blood, then probably it will help. You know, whenever you take, supposedly omega-3s, they studied that, and it's supposed to actually sort of make your blood less thick. I mean, anything that's going to make your blood less thick will probably help with clot formation. I don't know if that's been officially studied. Yeah. So again, you could use that. The recommendation here in the United States is actually people are, they actually put people on anticoagulation now. They put them on blood thinners such as Coumadin or Eliquis to thin out their blood. And when you see this happen, the blood clots going to the lungs, you want your blood to be thinned. I mean, you do not want your blood to be thick at all, because if that happens, then you die. If that stuff truly works in terms of thinning the blood to a level where you can't form clots, that's beautiful. It's from plants? It's from soy. What's that? It dissolves it. Well, that's pretty powerful stuff.
Anticoagulant.
Any other questions? Yes.
Is there a study on the relative incidence of myocarditis between the vaccine and the disease?
See, this is the problem with presenting with doctors in the audience. I had to look this all up in anticipation for a doctor asking me that question. The incidence of actually somebody getting a shot, a vaccine, his question was, what's the chances, or what is the incidence if you get a vaccine that you're going to get myocarditis? That's that's like big news on the headlines. The media has said, yeah, you can get myocarditis from the vaccine. Yes, you can. The chances are 2 out of 100,000 of getting it. 2 out of 100,000. So 0.02%. 2 out of 100,000. So it's relatively low, a low chance. It occurs mostly after the second dose, and it also occurs mostly in younger men. 20 to 40-year-olds, younger men, they get this myocarditis. Majority of the myocarditis gets better. But I'll be fully transparent. I've heard of stories, you hear these stories, right? And it's probably the same person. But I've heard of stories, a friend of one of our colleagues, medical colleagues, whose brother got the vaccine and developed myocarditis and didn't get better. And ended up on a heart transplant list somewhere. Is it possible? Yes. By the way, I looked up the incidence of dying when you get on a plane to fly to the Philippines. You know what the incidence of that is? It's about 1.67 for 100,000. So, about the same. Yes, another question.
Why do some doctors, medical doctors, recommend why do some medical doctors recommend steroid after COVID?
So why do some medical doctors recommend steroids after COVID? Steroids is sort of like a cover-all for inflammation. So remember I showed you that slide where it showed all these inflammatory markers that come out and destroy not only the virus, but destroy your body? Steroids will suppress all of that. It's kind of like a last resort. Patients get better, by the way, because it's too much. I mean, it's like literally too much. You think about the whole thing where you're like, I hate to use this thing, like beating a dead horse. I mean, you throw these inflammatory, it's not gonna help. That horse is not gonna get any better. And when you get to that point where everything is shutting down because of inflammation, you use these steroids, it blocks that, it lets the body have a chance to heal, and sometimes it turns around. So that's why, yeah.
If steroids can do that, why does the government not allow ivermectin to be used?
So I'm not going to even answer that question because we're going down the road of possibly not just medicine, but also politics as well. Yes? So why can't you vaccinate somebody who's 3.5 years old?
Someone who's 3.5 years old.
So why can't you I mean, just like every other medicine that we use, it usually the vaccine was being used under emergency use by the FDA because there weren't enough studies yet to show this, right? I mean, in kids, that's like a whole other world. I mean, you don't want to be giving this to kids when you don't know exactly what's going to happen, but the trials or the studies are actually coming out saying whether or not it is safe. I don't know whose kids they're using, but there are studies that are coming out that say that that it's safe for that age group. I don't know, Daphne, do you know what the youngest age group is right now? I thought it was middle-aged. 5. Okay. Yes, another question.
Regardless of immunity, which is more susceptible, the younger ones or the older ones?
So the question is, who's more susceptible to it, the younger people or the older people? All of the data tell us that it's older people. I had another slide which I didn't show up here, but it showed risk factors or comorbidities. So if you have other medical problems on top of age, if you're older, you have more chance of having worse disease. Young people get it, and they kind of not get so sick compared to somebody who's older. Even if you're old and healthy, you still get sick. If you're old and you have other medical issues, even high blood pressure, even diabetes, if you have heart failure to start out with, no good. I mean, if you get this, you have to be very, very careful. A lot of my heart patients, they've just isolated themselves. They've gotten their vaccine and boosters. They just stay inside. And when they go outside, rarely, are they going to like the stores and all this? Because if they get it, it's going to be very difficult to turn around. But to answer your question, older people are more susceptible to it in terms of also dying from it. Kids can spread it, though. As we know, even from regular daycare, kids can spread this. Yes? So her comment is that the younger people, you can't disregard that it being, something that's dangerous for the kids as well, because you remember that inflammatory syndrome, multi-system inflammatory system that I showed you there? It's not just in adults. There's a multi-system inflammatory response in kids. It happens just in children, and they shut down very quickly as well. So it does happen.
How old is old?
So old, so the definition of old is whatever age you are and 10 years after. That's old. Yes, another question.
It's not a question. I just wanted to add that a lot of the foods play a role in inflammation, anti-inflammation. like garlic, like tomatoes, beans, seeds, and stuff like that. So sometimes we worry about what I'm gonna do after I have the problem. So also we have to focus on what can I do to prevent the problem? What can help? There is no evidence that any food will cure anything. No. May help, yes. And so my invitation is, let's also focus on healthy eating, and all those foods and allicin from the garlic and stuff like that. Those things might help my immune system or so, will help to anti-inflammatory situations.
Yep.
Just wanted to point that.
Very good. Anti-inflammatory. Inflammation is sort of the root of a lot of this stuff that we're talking about here. Any other questions? I thought that would be more exciting to talk to you about than high blood pressure or something. Another question.
Another question. This is about diet. Now, we know that mushrooms extend your lifespan.
It what?
Extends your lifespan.
Yeah.
Okay. Your health span. What mushroom would help in prevention of this COVID?
I don't know.
Why is it that in China they call reishi mushroom the mushroom of immortality?
I don't know. I don't know.
No, reishi.
How?
Yeah.
You should tell my son he hates mushrooms.
Well, for one thing, they discovered in 2012, 2012, they discovered that a patient, this was in Australia, they discovered this patient with cancer of the stomach. He was told to come back, but because the surgery schedule was heavy, he was able to come back only 6 weeks later. In the meantime, a Chinese...
They took the mushrooms.
Yeah, the Chinese health practitioner, traditional Chinese medicine, told him to take as much mushroom, reishi mushroom in particular.
Yeah, just so that you guys know, there are a lot of things that are out there in terms of what you hear as what is good for you and what can potentially be beneficial. There was some kind of a Thai herb. What was the name of that Thai herb? There was a Thai herb that was supposed to be like the cure-all of COVID. You take it and you're cured. And this, I think every Thai person knew about this because it went through social media and people took it. It didn't make a difference at all. So, you got to have these studies that actually prove this. And I think there's stuff out there. I really believe that there are herbs that we don't know about in nature that actually help with this stuff. But if you know it and you have the scientific ability to bring it to a lab and have them study this and formulate it, that's how medicine progresses. So, but thank you for the comment. Any other questions? Yes.
When we're talking of the COVID, at the very start, and China became famous. They said it's from the cat. They said it's from the bat. Where does it feel?
There was an entire chapter on how these things come from these animals. I didn't read it. But yes, you're right. That's where it was initially supposedly came from. This area that they were talking about where it originated was in the marketplace where a lot of the stuff was not very clean. It was like a lot of raw stuff from what I hear. There was
a reporter from the U.S. that came back to you once.
Yeah.
And they were saying, they're still selling cats.
Yeah. Yeah, so remember, I was talking about here scientific information about COVID. When you start talking about this kind of stuff, very interesting to talk about, but you end up going down another road that's a different talk. And so any questions about the science behind what I presented here? Anything else? Okay, well, another one, yes. Yes, that's right. So, all right, well, thank you very much. All right.
Thank you. Thank you, Dr. Tessalee. How many have been blessed by this presentation and who have been informed well? Well, thank you, Dr. Tessalee. Thank you, Anna. And we are the temple. Your body is the temple of God. And I want just to emphasize that we are responsible for our body, and God entrusted our body, and we have to take care of it the most we can. And we have to follow and take care of ourselves. So if there's any more that you want to say, Ate Rita?
As everybody knows, my husband had COVID. He had a rough time. He belongs to the older generation. He has diabetes. He has high blood pressure. And it was only God who got him through COVID. And thank you so much, everybody, for your prayer. He is recovering very well.
Thank you for that. And we're all praying for those people who have been affected, and whatever long-term effects they have, we are keeping on their prayers and we are praying for them. So thank you, everybody, for coming. And we appreciate your inputs and questions. So we are going to end this presentation with Pastor Nestor's closing prayer. Is he here? I think I saw him earlier. He left? I cannot see him. Okay, can we just do our prayer? Dear Heavenly Father, thank you so much for this Sabbath day. We thank you for being together today, and especially listen to regarding our health, about COVID, about heart problem, about nutrition. Thou knowest, Lord, that you are the great physician, and we are responsible for our body because you have told us that we are the temple. Our body is the temple of God. Thank you, Lord, for the Sabbath day, and bless each and every one of us as we part from this place, and keep us safe. In Jesus' name, amen.